runner with calf, Achilles, or heel pain, and you want to continue training and not have to cut back very much. Well, there's a few problems with that, in that usually the reason that happens most of the time is that you're either increasing intensity too quickly, so putting on spikes and then doing repeat intervals or something like that, or you're increasing your volume, disregarding the 10% rule where you're increasing total volume more than 10% each week. And in some cases, patients are increasing volume and increasing intensity. That's a double intensity. That's the double whammy, and I'd be very careful with that because that is one of the most common causes of Achilles heel or calf strains. Let's talk about the most common areas of pain and what types of problems there are. Usually, the pain, if you have pain in your calf, so right in through here, this is the gastroc sitting over your soleus. So most people would just say, hey, I have a calf strain. But if it's in this upper part here and it's fairly superficial, that's the gastroc. That's used in power production, so when you're kind of towing off or jumping. A little deeper, so put all your weight on your forefoot, on your toes. So you can see his gastroc kind of sticks out there. His soleus is sitting underneath that. Now, that is usually more distance running. Go ahead and relax. That's distance running, a distance running muscle. It's not that simple, but it's close. Where if you're feeling pain deeper in there, then that's more the soleus. So gastroc, soleus, those are the calf muscles. If you're having muscles there or pain there, that's a strain. If you've got tension down or pain in through here, now that is the Achilles. Usually there's what's called an avascular zone. There's not a lot of blood flow through here. So that part is usually a tendinitis, like inflammation of the tendon, or a tendinosis, which again is too much volume over a short period of time, will cause strain to that tendon, especially if you're very, what we call toey, you're running too much on your forefoot. And then lastly, pain right at the insertion where the tendon attaches onto the bone there. That can be an apophysitis, which is essentially in kids particularly, as they're growing quickly and being very active between the ages of, let's say, 10 and 14. That's something called Sever's disease. It's not really a disease, but that's what they call it. And then also some of the things we look for are calcaneal stress fractures and so forth. So those are the most common things we look for in runners and active people in the lower leg here. When you come in for an assessment, what we'll do is go through range of motion, strength testing, or neurological exam to make sure this is not coming from something higher up, let's say your back or a hip. And then we do a full, what we call top-tier evaluation, which basically takes all the range of motion from your neck to a full squat, as well as some balance testing to just make sure that we're looking at everything and making sure that you're not having compensations from a different problem causing a lower extremity or a lower leg or foot or ankle problem. So once we have all that and we check your relative strength and so forth, we look at your full training program, because again, most of the time we find that patients are doing too much too quick. I don't blame you. You're really eager to get moving and performing your exercise or training. That I don't blame that you want to go really hard, but what happens is oftentimes the training is too much too quick. So we look at all of that once we have that full assessment and we've looked at your whole training program. Then we make a solid diagnosis based on that. Once we have a clear diagnosis, then we can move forward to treatment. Our treatment options are, in the office, we do soft tissue work like active release technique or something called fascial distortion model or trigger point. We even do dry needling depending on what you need. So if you need a little bit more blood flow in a tendon, we could use needles to increase that. Or we can use soft tissue work. Either way, we're loosening up that whole chain of muscles from the bottom of your foot, the plantar fascia, all the way up into your calf, sometimes into your hamstring, the back of your thigh there. So that's what we do in office, as well as chiropractic adjusting to make sure your hips and back are moving well, as well as your ankles. And then we give you some homework. So sometimes strengthening based on what's weak. sometimes stretching based on what's tight. And so we use a very comprehensive treatment process because we found that chiropractic, physical therapy or rehab, and manual therapy or massage, that all those combined works better than just any one of them by themselves. If this sounds good to you and you're looking for help to get better faster, give us a call. We'd love to help.